Welcome to the MiPACS Patient Updater training. In this session, we will walk through how to safely correct patient identity issues using the Patient Updater tool. This includes editing patient demographic information, moving an imaging series to the correct patient, and merging duplicate patient records. Keeping patient information accurate is critical to patient safety. Correct data supports accurate diagnoses. It prevents medication errors. It ensures patients receive the right care. Accurate data also supports care coordination, regulatory compliance, and billing. When patient data is wrong, the consequences can be serious. This affects both patients and providers. When MiPACS is integrated with an electronic health record, patient demographic information is received directly from the EHR. This reduces manual data entry. It also minimizes patient identity errors across systems. In most cases, this process works seamlessly. Even with EHR integration, issues can still occur. Patient demographics may be corrected after imaging. Manual entry errors can happen. Duplicate patient records may be created. An imaging series may be captured under the wrong patient. The MiPACS Patient Updater supports 3 specific correction scenarios: editing patient demographic information, moving an imaging series to the correct patient, and merging duplicate patient records. Before making any changes, it is important to choose the correct action. If patient demographic information is incorrect, use Edit Patient. If images are correct but associated with the wrong patient, move the study. If 2 patient records represent the same individual, start with the incorrect record and merge it into the correct record. If an image should not exist at all, stop and follow your organization's corrective workflow. Use Case 1. Edit patient information. In this first example, we will edit patient demographic information. Our patient is Indiana Jones. The patient ID is 1111. The date of birth is listed as July 2nd, 1899. The correct date of birth should be July 2nd, 1999. To begin, enter the patient ID or patient last name and select Search. Once the patient list is populated, verify the correct patient by confirming the name, patient ID, sex, and date of birth. Select the correct patient from the list. Next, select the Edit Patient button in the lower left corner of the screen. The Edit Patient window will open. On the Edit Patient screen, confirm that Change Patient Info is selected. Review the existing patient information displayed on the left side of the screen. On the right side, locate the Date of Birth field. Select the Date of Birth field. Change the year from 1899 to 1999. Only change the field that needs to be corrected. Once the date of birth has been corrected, select the Change button. You will now be prompted to enter a reason for the change. Enter a clear and specific reason. For example, corrected date of birth to match the source record. A confirmation message will appear stating that the patient has been successfully changed. Select Close to return to the Patient Updater. This completes the process for editing patient demographic information. Use Case 2. Move an imaging series to the correct patient. In this next example, we will move an imaging series to the correct patient. An FMX series was captured under Quincy Jones. The patient ID is 2222. The series belongs to Davy Jones. The correct patient ID is 3333. Start by searching for the patient who currently has the series. Enter the patient ID for Quincy Jones and select Search. Verify the patient record and select it. In the Series section, locate and select the FMX series that needs to be moved. Confirm the series description and date. With the series selected, choose Edit Series. The Edit Record screen will open. You are now on the Edit Series tab, which is the default tab. Verify the existing patient information shown on the left side of the screen. Select the option labeled Move Study to Existing Patient. In the Destination Patient ID field, enter the correct patient ID for Davy Jones. The patient information will auto-populate. There is no need to select from a list. Verify the destination patient details. You will now be presented with two options. Copy will duplicate the series to both patients. Move will transfer the series so it exists only under the correct patient. Select Move. When prompted, enter a reason for the change. For example, FMX captured under wrong patient and moved to correct patient record. A confirmation message will appear indicating the study was successfully changed. Select Close. To validate the change, search for the destination patient. Confirm that the FMX series now appears under the correct patient. Use Case 3. Merge duplicate patient records. In this final example, we will merge duplicate patient records. Two records exist for the same individual due to a manual entry error. The correct patient is Davy Jones. The patient ID is 3333. The date of birth is October 31st, 2000. The incorrect duplicate patient is Davy Jones. The patient ID is 3333. The date of birth is the same. We always start with the incorrect record. Begin by searching for Davy Jones and selecting the incorrect patient record. Select Edit Patient. On the Edit Patient screen, choose Merge with another patient record. Verify the existing patient information on the left side. This confirms the record you are merging from. In the Patient ID field, enter the correct patient ID for Davy Jones. Select Search. The destination patient information will auto-populate. Verify the destination patient details. Confirm that both records represent the same individual. Once verified, select Merge. When prompted, enter a clear reason for the merge. For example, merge duplicate patient created by manual entry error. A confirmation message will appear indicating the patient records were successfully merged. To validate, search for the correct patient. Confirm all images and series are present. Confirm the duplicate patient record no longer exists. When not to use Patient Updater, the Patient Updater should not be used to remove images. If an image should not exist, follow your organization's administrative or corrective workflow. Summary: edit patient information when demographics are incorrect. Move studies when images belong to the wrong patient. Merge patients when duplicate records represent the same individual. Always verify before proceeding. Thank you for completing the MiPACS Patient Updater training. Accurate patient identity protects patient safety, clinical integrity, and compliance.